Do you know what are the specific postnatal problems?
I think one of the specific postnatal problem is painful perineum, bladder control, bowel control, circulatory problems, or maybe there is that's disease of the rectal abdominal muscle. Do you know the other specific postnatal problem, Anis?
As in my knowledge, I think that it also spinal pain, pelvic surface pain, maybe some mother will experience headache, carpal tunnel syndrome, deep syndrome, and also coccygeal.
Wow, so all these problems needs to have management, right?
Yes, absolutely.
So we need to watch the management videos after this.
So, how to treat the perineum? Okay, firstly, we have various modalities. We can use ice, which is the most helpful modalities in treating the perineum, and then we can use cold and warm bath, which is cold bath is actually more effective than warm bath, and then we can also use saline bath, and also we can also use oral anesthesia, and also we can use ultrasound. So what are the basic treatments? So first we can eliminate the traumatized tissue, which is usually we do this on the bed, which is when, for example, you have abdominal pain, which is, and then you must elevate to the proper position. And then the second one, you can apply ice in the affected area, which is immediately after post delivery, around 10 to 15 minutes, every 2 to 4 hours for first 24 to 6 hours. We can do exercise, which is the pelvic floor exercise, using a contract and relax technique, which is this technique can increase circulation and also reduce the edema. We also need to use an appropriate cushion when sleeping.
Bladder and bowel control problem is always been an issue for the woman after the childbirth. It was a common problem during the postnatal care. It causes by the progressive weakness of pelvic floor muscle by the combination of the hormone and the stretches muscle during the childbirth. The weakness of the pelvic floor muscle can allow the bladder to leak. This problem will allow you to have a sudden urge to urine or during the postnatal care.
Next, for the bladder and bowel control treatment, we can also use as a strengthening exercise either our pelvic floor muscle, called as a Kegel exercise. Second, we can also use bladder training to increase the bowel and the bladder control. Third, we can also use nerve modulation to reduce the pain of the uterine contraction. Fourth, we can also use electrical stimulation to improve the pelvic floor muscle contraction. And fifth, we can also advise the mothers, the postpartum woman, to maintain the healthy diet. Next problem is DRAM. Okay, what is DRAM stand for? So DRAM is stand for diastasis of rectal abdominal muscle. Okay, so what is DRAM? DRAM is the condition where the rectus abdominis muscle separates in the midline at the linea alba. So the diastasis is defined as a gap between the rectal abdominal muscle of greater than 25 mm, which is we can just palpate just superior to the umbilicus. So the separation of the linea alba may occur during pregnancy or after pregnancy. So what are the treatment as a physiotherapy? So what are the basically the focus on the region and also the degree of the diastasis lah. Maknanya nak buat satu exercise tu kalau nak buat satu exercise, kita kena tengoklah jarak dia tu macam mana lah. So the patient ataupun the mother must start the exercise using the isometric abdominal exercise in all functional position lah. So my position pun boleh. So selalunya orang akan buat macam supine. So when the pelvis kita dah stable, kita pun dah okay, so kita boleh increase the intensity ataupun increase the difficulty in the exercise lah. So first kita boleh increase the repetition, and then kita boleh increase the endurance, and then kita boleh add in loading lah. Maksudnya kita akan letak berat ke, tapi tak berat sangat lah.
Back with your knees bent and your feet flat on the floor. Try to hollow out your stomach by sucking in your abdominal muscles and engaging, squeezing those muscles. Tighten them in this position and hold for 3 to 5 seconds. And release. And repeat. Continue to breathe as you tighten your abdominal muscles. Hold each time for 3 to 5 seconds.
Spinal and epidural side pain. Spinal pain is a very common postnatal complaint. 37% of a woman will still experience some back pain during their postpartum period. The location of the pain is most frequently in the posterior pelvic or in the lumbar area. It causes by the hormone release in the pregnancy, the ligamentous laxity, which muscle affect the biomechanics of the pelvic girdle and vertebral column. The laxity of the joint may remain for some time after the delivery of the baby. So the laxity of the joint do not have only during the pregnancy and the labor. It is even remain after the postpartum during the postpartum period too.
For the spinal and the epidural sac treatment, we can use gentle mobilizing back exercise, which is belly rub. Second, we can also use ultrasound, and then lastly, we can also use a hip rotation exercise for the spinal and the epidural sac treatment.
Sekali nak tahu varicose vein tu macam mana kan? Varicose vein tu macam ni. Okay, ini varicose vein. Okay, varicose vein ni sebenarnya dia develop during pregnancy. Mana dia terjadi kan? So sebenarnya varicose vein ni dia terjadi disebabkan oleh adanya changes in the maternal blood circulation dan juga disebabkan oleh presence of progesterone on the smooth muscle of the venous wall. So selalu kan varicose vein ni dia sebenarnya sebelum pregnancy, waktu pregnancy ada, tapi kadang-kadang selepas pregnancy dah tak ada, tapi kadang-kadang dia akan reappear balik lah. Setengah orang ataupun certain women, the varicose vein is sometimes is severe, postnatally lah severe. It is advised ataupun dinasihatkan when mother is feeding the baby should not sit cross leg. Actually kan dekat varicose vein ni lah tempat yang kalau nak tengok kat mana varicose vein ni macam ada gambar tadi kan, dia dekat calf muscle. So jadi kita kena buatlah encourage mother tu untuk buat keras exercise dan fokus on her calf muscle.
For the decurving tendonitis symptom, it is a painful condition affecting the tendons on the thumb side of the wrist. It most commonly the result of the carrying the child, leading to obvious of the wrist. That's why a lot of postpartum women receive this kind of symptom, which is decurving symptom. It is because of awkward hand position and repetitive tasks needed to be cared for a newborn, such as grasping, pinching, squeezing, and certain recurrent movement of a wrist. It also causes by the excessive friction in the scallop.
For the next problem is called as a decurving tendonitis. The treatment for this problem is one is resting of a wrist from doing any movement at our wrist. Second, we can use a spin to restrict the movement and friction at the scallop process. And third, we can also use electrotherapy treatment to reduce the symptoms.
Next problem is the carpal tunnel syndrome. Okay, actually carpal tunnel syndrome ni is rare lah. Maknanya not all new mother or during postnatal, mother experience carpal tunnel syndrome because this is rarely. Usually kan, carpal tunnel syndrome ni disebabkan oleh maybe because of the carrying the baby, we always carrying baby or our position is wrong next, and then can get carpal tunnel syndrome. The management is not too hard. First, kita kena refrain the mother from sleeping on the affected side. Maknanya kalau tangan kanan sakit, jangan tidur belah kanan, tidur belah kiri. Kalau boleh, tangan yang sakit tu, which is when if you have carpal tunnel syndrome on your right hand, and then you must elevate the hand lah to betulkan circulation or to get a better circulation. So if possible, wear a sling lah, night sling to maintain the neutral position lah. Tak adalah kalau tertinggal ke apa kan tak sakit lah. Dia macam support, so it's like you support the hand. So if the mother has the edema or swelling, we can apply ice pack lah, or ice bag or ice gel to reduce the swelling. And then we can use electrotherapy, and also we can massage. Okay, so for the first one, exercise for carpal tunnel syndrome have two, which is we have tendon glide and also nerve glide. For tendon glide, there are 9 steps. The benefit of the exercise is to reduce the swelling and also to increase circulation of the hand. For tendon glide, the exercise is doing for 5 cycles, 3 to 4 times per session or per day. So the next exercise for carpal tunnel syndrome is nerve glide, which is we have 6 steps or 6 position. 1, 2, 3, 4, 5, and 6. So the purpose of nerve glide exercise is to maintain flexibility of the nerves and ligaments. This exercise is done 5 cycles per session, and do it for 3 or 4 times a day.
This 5 minutes daily breast massage can be done by a mother who has problem in breastfeeding her baby. Moreover, mother can massage her breast before pumping the milk or before breastfeeding the baby. So basically untuk ibu yang ada masalah sore breast disebabkan oleh engorgement, so ibu ni bolehlah dia buat ice pack sendirilah. Ni lah antara cara-cara untuk buat ice pack di rumah. So let's watch for Kegel exercise video. From Kegel exercise, we can treat all the postnatal problems that has stated here.
Okay, for the correct form of exercises, this exercise is aimed to prevent our incontinence, and as you know, for the postnatal woman, the common problem happen for them is incontinence. So these exercises I will be doing will improve the bladder and bowel control of postnatal women. Okay, so for these exercises, we will do for 3 sets, 10 repetition a day for the postnatal woman. Okay, so the position of these exercises is long sitting position. So before doing it, we have to feel the contraction of our core muscle and the pelvic floor muscle. So we have to keep it straight before doing it, and then our position of our hand on both side on the side, and then when the exercises, we have to flex the hips. When you flex the hip, we have to inhale, and when you extend, we will exhale. Okay, so we will do alternately on both side of our leg. So breathe in, breathe out. Okay, so we will be doing it for 10 times. Okay, so 1. Okay, make sure to be straight. 1, 2, go. Breathe out. Breathe in, breathe out. So make sure for the postnatal movement, you will be doing in a slow progression because it will be increase the muscle endurance of our pelvic floor muscle. So the postnatal movement are usually doing this exercise after 4 to 6 weeks after the childbirth. Okay, this is for the first exercises. For the second exercises, we will be doing sit position, long sitting position, and then on both sides also. But this time we will flex hip simultaneously on both sides. So first we will do. The example is breathe in, breathe out, breathe in, there is an abduction of the hip when we're doing it. So breathe in, breathe out, breathe in, breathe out. So after doing it for 10 times, the postnatal movement will stop, and doing it for one set is 10 repetitions. Okay, that's all.
Sing this song, so wrap me in plastic and make me shine. We can make a dollhouse, follow your design. Let's sing this song, so wrap me in plastic and make me shine. We can make a dollhouse.
Same as from the Kegel exercise, we also can treat all the postnatal problem that has stated here.
Okay, physiotherapy exercises, and this is pelvic floor muscle that is aimed for to increase the pelvic floor muscle recovery after the childbirth. So after the childbirth, most of the pelvic floor muscle more weakened. So these exercises is to increase the healing of the pelvic floor muscle. So the position of the postnatal movement, we have to do in group lying. We will do for the 10 repetition, 3 sets per day. So our hip needs to flex, and then when you inhale, make sure you extend the leg, and then when you inhale back, inhale, exhale, and then go back to the normal position. Okay, we will do for 10 repetition. So the head position of our head is on the side. Okay, so first inhale, exhale. Okay, we will do alternately. And okay, so after we know the exercises, we will do alternately on the both sides. Inhale, exhale, make sure we have to do the exercises slowly to increase the muscle endurance of our pelvic floor muscle. Do not rush it because it will injure our pelvic floor muscle, especially for the postnatal movement after the childbirth. These exercises will help to increase the recovery of postnatal movement. Okay, so that's all from me.
Right defecation technique is also one of the treatment for painful perineum problem.
The blow as you go strategy is a strategy to help avoid straining during bowel movement. You will first start by taking a deep breath in and filling your belly with air, and then creating a fist with your hand, and then blowing out through that fist and directing the pressure downward to make passing a stool easier.